welcome to Therapy Thursdays, where we bring the therapist to you. I am so happy that you guys are here with me. My name is Marcus Alexander Velasquez, and I am your host. Therapy Thursdays is a beautiful show. It's becoming better than I even thought it would. This is a place where we are extremely honest when it comes to all things therapy related, mental health related, and we are serious about growth as humans. And we want to see the best versions of ourselves as well as help as many people as possible in that process. So I'm very happy you guys are here with us. As always, I will start off with our disclaimer just to make sure things are set. So, as always, our disclaimer is that this show is for informational purposes only. You are completely responsible for what you do with the information presented, and myself and all of our guests cannot be held liable for any misuse or misunderstanding of the information presented. Please always consult a trained mental health professional before making any decisions regarding treatment of yourself and others. So again, welcome. We're happy that you're here. Today's topic is going to be a heavy one, but of course it's much needed. We are not afraid to dig deep in this show. We are not afraid to talk about the tough subjects because it's part of life. Life is the good, the bad, and the ugly, and we're here to talk about it all. But not just talk about it, learn from it, grow from it, and push each other to become, again, the best versions of ourselves and keep each other accountable. Today's guest therapist is now joining us for the third time in a row, and I really appreciate her being here. I don't even know if I told you, Ro, that you were the first therapist to sign up on the spreadsheet, and you signed up for 17 episodes, which is wonderful. Thank you for that, because when I first started, I'm emailing hundreds of therapists, and they weren't all responding, so I was a little discouraged at first. But you signed up for 17 episodes, and I was like, that's the motivation and the push I needed. So thank you for believing in the show, and thank you for being here. So welcome.
Thank you very much. I apologize in advance. I will, after the show, before the show, my technology wasn't working. Anyway, I was looking up support group emails to tell people. I haven't been able to do it yet because of the technical problems, but I will after the show is done or later on in the show.
Okay.
So completely honest, I'm a survivor of abuse, like many people.
Yeah, so let's get into that. So today's topic is abuse and survivors of abuse. So that's, as always, every episode is only an hour long. We can only get so deep into these topics. So really our shows are more of a general overview when it comes to these topics. So we really just, we see things from an aerial point of view. We don't really get too granular because time restraints. But the purpose of it is to at least hit on these topics so that we can talk about it with people so that people can say, hey, that affects me in one way or another, or I know someone that is affected by that episode's topic for the day. And of course, our goal is to always spur people on and spur you on to sign up for formal therapy. So yes, today's topic is abuse, survivors of abuse. That is a very general topic. A lot of things can be covered under the title, the umbrella of abuse. There are multiple types of abuse, but obviously we're going to talk to a professional today. Our guest therapist is Ro Bernardini, and we're so happy to have her here. So yeah, Ro, give us a little bit about abuse as far as, so let's start with the main question, which is how would you define abuse? Because like what happens a lot when we talk about in this show is there are terms that are used but can be used incorrectly. So I want to make sure we're using it correctly. So if you could please define abuse for us.
Okay. Abuse is physical, mental, sexual, emotional, any other kind of way of abusing. Some children get starved, some children get beaten, some people get sexually abused, physically abused. There's something called medical abuse, which is called syndrome called Munchausen's by proxy, where the mother or father will purposely make the child sick, and then everybody's sympathetic to the poor mother, yada, yada. But there's endless varieties of abuse. So if it is something that interferes with boundaries from parent to child, sibling to other child, that is abuse. If it impairs emotional development, physical good care. These are abuse and or neglect. Um, Oftentimes, it leads to a condition called PTSD, post-traumatic stress disorder, which is often or is usually accompanied with flashbacks, night interruptions, bedwetting, um, terror, night terrors, a fear of going outside. That's agoraphobia because something happened outside that was so frightening that the
Mm.
person can no longer go outside. Um, and lots of other things. Does that give you a hint? If it injures your development emotionally, physically, medically, sexually, these are things that are called abuse. Outside the parameters of normal parent reasonable discipline.
Yeah, that's great. Thank you so much. That's a great start to the topic for today. So again, I want to make sure we're using the term appropriately. Abuse can take on many different forms. There may be people watching that have gone through their own version of abuse. So I want to know, what does abuse look like, practically speaking?
On a physical level, it would show up as bruises, cuts, starvation, um, overfeeding, interruption with gastric processes, enemas, things that would have changed the bodily functions of a person. What does it look like? It doesn't abuse. It doesn't always leave fingerprints, but it does leave scars. For
Mm,
example, it's a form of abuse called withholding. Some people are married and the husband or wife won't have sex with them. Well, that can be a way of torturing the person. It's emotional abuse and physical to some degree. Um, there's, but it doesn't leave fingerprints, but it does leave scar. Abuse has many different parameters and different ways of being inflicted. Um, that's a good starter. I think that knowing that you don't have to have bruises to be abused, that's the most obvious form. Prior to Oprah, you're probably all too young to remember this, people didn't talk about any of this. It never got mentioned, never happened, whatever. And then Oprah really opened things up for putting it all out on the table. So for people to realize that this is very common, 1 in 4 American women is abused by adulthood.
wow.
Maybe 5, maybe 1 in 5, but a lot, a lot.
Wow.
1 in 7 experiences acute depression in lifetime, Americans. Um, Part of me feels like the abuser usually is a very angry and internally depressed person. Usually it's male to female, but it also happens the other way, although not as frequently, or at least not discussed as frequently. Um, it's also contributed to by patriarchy, men dominating women, women being, the nice little lady who does the laundry, makes the food, cleans the house, has the babies,
Mm,
and has to wait on the husband. That's a form of abuse too. It's emotional abuse. So,
wow.
any more? Do you want me to be more specific in any way?
Yeah, you hit on a good point that I actually didn't even think about, which was signs of what an abuser looks like. Can you dive deeper into that or give us a few more examples? Because I feel like I'm sure some people have experienced abuse from someone they maybe never even thought uh, would abuse them in the first place. So obviously, if we can prevent problems from happening, that's the best case scenario. So what are some characteristics of abusers that people should be on the lookout for?
The primary one is boundary violation. Emotional boundaries, physical boundaries, sexual boundaries, social, societal boundaries. If it's something that you don't want happening to you, it is abuse. Now, I'm not talking about a parent giving a swat on the bottom to a 3-year-old or 10-year-old or whatever. That's not abuse. But if it gets bruising, if it gets continual, if it gets injurious, that is abuse. Um, Sexual abuse. There's the overt kind of sexual abuse, someone touching in a physical way, of unwanted touch or inappropriate touch. But there's also emotional sexual abuse, covert sexual abuse, where a daughter and father or mother and son are a little too overly cozy. And the parent takes the child on in some ways in a spouse role, which then emotionally freezes the boy or girl uh, and causes psychological injury.
Hmm.
Lots of different forms, like I said.
Yeah. So you mentioned about abusers that is an often sign of an abuser is somebody who doesn't respect your boundaries. Is there anything else that people should look out for when it comes to a potential abuser?
Anybody touching inappropriately, anybody, anything, yeah, anything that makes you feel uncomfortable around that person. If Uncle Charlie or Aunt Mary touches you in a way that makes you feel antsy, just uncomfortable, heads up, that's a red flag.
Hmm.
I mean, not a nice hug from a relative you like, but something that makes you feel very uncomfortable. Listen to that. It's a red flag and don't ignore it. People often go to their parents and say, Uncle Charlie or Aunt Mary touched me where I don't want to be touched. Oh, come on. Aunt Mary or Uncle Charlie would never do that. Well, yeah, they would. Some
Hmm.
of them would.
Yeah.
So if your parents or a parent's child's parents don't intervene, go to a school teacher, go to a school counselor, go to a school counselor. They are required by law, at least in this state, to be called mandated reporters. If a child comes and says, Uncle Charlie touched me inappropriately, the school counselor is obligated by law to report it, or he or she will get into legal trouble. So it's called a mandated reporter. And if you can't get a family member to respond, oftentimes religious people say, oh, that's not so. Your mom or dad's too nice to allow that to happen. Now, they aren't always the most reliable people to report to, but a mandated reporter is required by law to report it. And if they don't, you call them.
Hmm.
If you're old enough to call Child Protective Services for yourself and because nobody else is acting on it, do it. 1-800-25-ABUSE in Illinois. I don't know what it is other places, but Child Protective Services will intervene. They are required by law.
That's great. That's a great resource too. Thank you for sharing that. I'd like to focus on abuse of adults. So, like you talked about, one thing to look out for with an abuser is the lack of respect for boundaries. So, can you talk about like some things to look out for as an adult when it comes to like emotional abuse and verbal abuse? What are some things that maybe somebody's like, this kind of, it makes me uncomfortable, but I don't know if it's exactly abuse. Like,
Right.
how would you be able to help them differentiate between what is actually abuse or not?
Well, there's a lot of things. If it makes you feel uncomfortable, talk to your girlfriends. Are they getting this kind of treatment? Talk to a therapist, talk to a counselor, talk to a friend, talk to anybody that you can say, do you think I'm being overreactive? And some people might say, yeah. But if it happens continually and you're continuing to feel uncomfortable with it, that's abuse. It needs to be talked to. Maybe you need to speak to a counselor, a marriage counselor, a couples counselor, an individual therapist. But if it's making you uncomfortable in a continuous fashion, that's abuse of one form or another. I had someone recently who told me, very high professional, very well trained, high up in the professional community, say that her now ex-husband, whom she recently divorced, gaslighted her. Do you know
Mm.
what gaslighting is, folks?
We've heard the term, but if you wouldn't mind giving us a proper definition.
Okay. It makes the person feel like they are testing their own, they make you doubt your own sense of reality. I had a
Mm.
boyfriend, ex thankfully, who, when I was going to apply to take the law boards, he said, I'm doing this for your benefit because I don't want you to feel hurt when you fail terribly. So maybe you shouldn't really take the law boards. And guess what? I didn't. Those were
Mm.
the days back then. But I realized now he was just threatened by my moving forward. The person I was referring to uh, was being gaslighted all the time. The term comes from a movie from the 1940s where a woman, that's when they used to have gas lights that got, the light got turned up and down by the gas thing. And her husband would make it flicker. And she would say, did you see that? And he'd say, no, see what? And she started like, am I nuts? Am I imagining this?
Mm.
To question your own sense of reality. and your own worthwhile. So that's very damaging, and it goes on today.
Wow.
It does leave scars.
Wow. Yeah, I think that's great. I think it's a good point to note that if somebody has, what we often call that gut feeling, to listen to that. And if there are continual situations where you're constantly doubting yourself or questioning that gut feeling, that may be signs of abuse. If the situation or the abuser or the person is continually making you doubt yourself and doubt your own feelings and doubt your own mindset. I think you made a great point to ask others, friends, co-workers, people you go to school with, definitely people you trust, number one. But to hear their input and to find out if, hey, these things I'm experiencing, can you, confirm or deny them? Can you let me know if there's validity to what I'm feeling, or maybe I'm overreacting? I think that's great for practical advice. So if anybody out there is watching this and they feel uncomfortable, definitely get the input of several trusted friends and family members to either confirm or deny the way you feel.
The way I look at it, and maybe I should write a book with this title, your head will lie to you, your feelings never will. So if you're feeling creepy in a situation or uncomfortable, your feelings are telling the truth. Your head may be saying, oh, it's no big deal. But if your body's reacting to it, it is a big deal.
Wow, that's a great point. If you can touch on what are some of the residual effects of abuse?
Well, it impairs abilities to be intimate as an adult or in an intimate relationship. There's people who are sexually repressed as a result of overly intrusive boundaries of a parent, relative, father, mother, whatever. People are often phobic about various things, like I don't want to, if your family is alcoholism, you don't want to go near anyone alcoholic, which is probably not a bad idea, actually. Sorry, anybody out there who's alcoholic and recovering, I'm sure you're very nice. Um, but, you know, what are the question was again? Tell me.
Just some, if you can name some residual effects of abuse.
Oh, yeah. Well, fear of whatever the situation was that caused the abuse in the first place, whatever the violation was, that for sure. But also PTSD, post-traumatic stress disorder. Usually people who've had mild abuse or gentle abuse even feel uncomfortable. Post-traumatic stress disorder, that can happen to somebody who's more acutely abused and or a person who's just much more sensitive to unpleasant situations. Um, PTSD means flashbacks, sleep interruption, nightmares, terror, um, inability to create relationships, inability to tolerate anger, inability to
Mm,
express anger. Basically, frozen. People get frozen. Um, the three things in life are fight, flight, or freeze. Now, if you're a parent or if you're an adult, you can fight or you can flight, go into flight. But if you're a kid, what do? You freeze.
mm.
You shut down. You become numb. You get disconnected from your body and mind. Your mind and maybe you live in your head all the time, but your head and body are very split off from each other. And that's where therapy works in getting the head and the mind to begin to be united as one and to get people into their feelings.
Yeah.
Man, just
That's
went a
great.
little bit.
That's actually that's a great segue into my next question, talking about therapy. So, as always, we promote formal therapy here, as opposed to just talking to your friends or somebody that you trust. A therapist obviously is formally trained for these kind of things. They have experience in helping guide people. So, on the topic of therapy, how can a therapist help a person who's been abused?
Well, first of all, I had a patient once who wouldn't discuss it for 7 years because she was so terrified to even let it come into her head, to come out of her mouth, the words to come out of her mouth.
Well,
And so it came. What happens to the person? A lot of sense of shame, guilt. I must have done some. I didn't eat my green beans, therefore Uncle Charlie abused me. Therefore, I am a bad person, and I probably brought it on myself, and I'm rotten, and I'm no good. Low self-esteem, fear of trusting anyone, but the most reasonably trusted person. Problems with intimate relationships, emotional and physical. Um, fear of new places, fear of meeting new people, social anxiety, phobias, the PTSD trauma thing. There's a wonderful book that was written a long time ago called Trauma and Recovery. It's about 300 pages. The first 150 pages do not read unless you want to become a psychoanalyst. The last 150 pages goes through every various kind of trauma that people have had, like prisoners of war, rape victims, drug abuse, white slavery, black slavery, anything that is traumatic. And it talks about the kind of way people respond to it. Some people completely block it out. Didn't happen. I don't know what that was. I think I dreamed it, whatever. Now there's been a lot of talk about, is a dream enough to completely verify it? I don't have an answer to that. Some people say yes, it's at least something worth exploring for sure. Some people say no. So I don't know, but if you've had a dream that you've been abused in one way or another, and either it keeps repeating and or it just won't leave you, go talk to somebody about it.
Yeah.
There we go.
Can you walk us a little bit, in even general terms, of course, but can you walk us a little bit through what the process is like for a victim of abuse working with a therapist and some of the things that you'll do with your clients or walk them through?
Right. I don't push. People aren't ready to talk until they're ready to talk, until they feel safe. So the first thing is to create a safe environment where the person knows they can tell you to go to hell if they want, or they can stand up to you and feel safe, and they're not going to be injured or hurt or humiliated or whatever. That's number one. But that's number one for everybody, for every kind of thing they come in for. But especially with abuse victims, because they're phobic. Why wouldn't, I mean, they're trusted people in life, husband, wife, mother, father, whomever, have violated them. So violation is something they're familiar with and terrified of. So to make it a safe place. After that, as the patient is ready to talk about it, I say, when and if you are ready, you will talk about this. I'm not going to push you. I'm not going to dig if you don't want that. That's fine. We'll just take it slowly and take it at your speed, because you felt out of control all of your life because someone violated your own sense of free will and autonomy in one way or another. So building autonomy and free will and freedom of speech, as it were, are very important to giving the person a sense of control over their own self, mind, and body. So that's sort of a beginning phase, and that takes a while, depending on the person and how bad the abuse was. Let me see. So, and after that, as they're ready, bit by bit, things just, I remember such and such happened. Oh, yeah. And then 3 weeks later, oh, yeah, remember when I mentioned such and such? Well, there was another part to it. And then there was another time. And then it starts coming out. And then what starts happening is rage, which is good in the therapeutic setting, that they're angry at the person who violated them. Why wouldn't they be?
Yeah.
But rage covers over great sense of grief and loss and violation. And going through the violation, going through what led them to be so mistrustful of everybody, begins to free them from the prison of the trauma of the abuse. Now, does it go away 100%? Not really, but it goes away 95% or 97%. And that's enough to get through life and enjoy life and not let it inhibit you one way or another.
Yeah, absolutely. You mentioned a description of abusers are people who consistently don't respect your boundaries, don't respect the person's boundaries. So that's interesting. So I'm curious to know, what are tactics or boundaries that one can put in place to avoid being abused?
Don't be alone with the person.
Hmm.
If you're a minor, go to your parents. If your parents don't respond, go to the school. But don't be alone with them. I had a patient once, and his ex-wife's brother molested a child, was one, sexual offender, but he was allowed to be alone in a room with an 8-year-old kid. I said, that is not okay. That is not okay. If a child, give the child permission to always protect themselves, to come to mom or dad and say, Uncle or Mary or Aunt Mary or Uncle Charlie, hurt me in such and such a way, and not to disbelieve them. I've had people say when they told their parent about being abused, "Oh yeah, was it good?" You know,
Oh,
mocking,
wow.
really awful.
Wow.
And but for the parents, anybody here is probably over 18 and may or may not be a parent at some point in their life. Listen to your kids; they don't make it up. How could an 8-year-old or 6-year-old come up with that kind of story?
Yeah. So how about adults? What can adults do as far as tactics or boundaries to put in place to avoid being abused?
Well, there's called divorce. There's called couples therapy, although if a person's that far gone, I'm not real optimistic about, progress, but you never know. That
Yeah.
happens. Um, so I would not be alone with the person.
Mm,
If it's a husband or wife or spouse, and you need to, if you're being abused either physically or mentally, you need to seek professional help. You might want to get an order of protection to keep the person away from you. You might want to see a couples counselor. You might want to live separately. You might want to never be alone with a person. But protect yourself, number one.
yeah.
Things I'm sure you all watched some of these crime shows on TV, who gets murdered and who doesn't. But if you think your life or physical being is in danger, leave immediately. Call the police. Also, though, the police have gotten better about it, but it's just a couple's fight. They'll get over it. Not necessarily. So if someone's threatening you, leave. Leave now. Go to a police station. Go to a women's shelter. Go to visit a friend. But get out. You can always
That's great.
seek legal. And if a woman or a man is in financial trouble, they can go to legal aid. They will provide them with legal assistance to do what's that called? Orders of protection to keep the person away from you. Now, that's not necessarily a guarantee that the person is going to stay away, but what people say, oh, it was only one time. It won't happen again. Then the person, the abuser, there'll be a honeymoon. Oh, sweetheart, I love you. Here's some flowers, yada yada. But if it happens once, it will happen again.
Mm.
It's just
So
what's
I'm
that bound?
curious. Yeah, so I'm curious, in your professional opinion, what in your experience and your learning, what do you believe causes people to abuse other people?
Maybe they were abused themselves. Maybe they were neglected. Maybe that's what they witnessed growing up. Like father, like son, like mother, like daughter, I suppose. But it's denial of their rage, anger management problems, inability to express anger in a reasonable and way that is constructive to a relationship. That can be learned. But I had a woman like 40 years ago, woman patient who'd been married 3 times. Each husband had broken her right arm.
Wow.
3 husbands. So she is what we call co-consensual abuse, because she kept choosing the abusers to marry. But there are people who stay in a marriage like that either because although nowadays, thank God, there are women's shelters, there's women's support groups. In the olden days, like when I was growing up, there was nothing for women. I mean, you just put up with it, or you know.
Yeah. All right.
But this,
So just a quick break for that. It is 7:30. We are shifting into the second half of our program, which is our live Q&A section. So if anyone who has joined us today has any questions on our topic today, which is the topic of abuse, but on any topic, therapy or mental health related, please type it in the chat. We would love to answer your question before the show is over. So again, if you have any questions on our topic of abuse or mental health or therapy related, please type it in the chat and we would love to answer your questions before the episode is over. In the meantime, Rose, so I have a question. If let's say I know somebody or one of our audience members knows someone who is being abused, how can they help someone? So let's say I have 2 examples here. Let's say it's either a person involved in domestic violence, which I know is one of the more popular ones, unfortunately, or child abuse? What would your advice be for people in those two scenarios if they know someone who's involved with domestic violence or they know a child that's being abused? How can an outside person help?
Please call that number. In Illinois, it's 800-25-ABUSE and report. You can report anonymously. You can, if you're a mandated reporter, you're required by law. But if you don't want your name to be involved in it, you report anonymously, and they are required by law within 24 hours to investigate child abuse. And, you know, a lot of times they just sort of say, well, they keep an eye on them, though. And if another abuse report comes up, then they're, you know, taking it more seriously. But if there's bruising or whatever that they can prove that there's been hitting or something or other, or neglect, medical neglect is also part of child abuse, call 1-800-25-ABUSE. It's not a pleasant call to make, but if you tell them you want to remain anonymous, they will not push you. So just tell them what you need to tell them, where the people's name, where they live, blah, blah, blah.
All right, so just to confirm, the number you said was 1-800-25-ABUSE?
Correct.
And that's for the state of Illinois?
But you can go online in any state and ask for Child Protective Services hotline, and there will be a number you can call, and there's someone on 24/7.
Okay, great. I was double checking because I wanted to put that in the chat. So I just typed in the chat, 1-800-25-ABUSE, and that's to report any abuse in the state of Illinois, correct?
Right.
Awesome.
But in every state, there's a line for that somewhere. Look online in your state, wherever that is.
Awesome. That's great. Yeah, for those who are in the chat, I put the phone number that Ro mentioned in the comments. Again, if you have any questions that you'd like to ask on abuse or any mental health topic, please type it in the comments. We would love to answer it to the best of our abilities, but we will keep the conversation going in the meantime. This is a very real question, Ro, because as you know, like we talk about theory versus practice. So when it comes to theory, you know, we have all the answers. You know, we have all the answers that sound good in the most ideal situations. We can read scenarios and solutions out of a book, but when it comes to practicing these things out, it's not always as clean. It's not always as easy. There is pushback. So this question would be more of the practical, somebody practically living this out and how they can actually deal in this scenario. So the question is, what should someone do if they're afraid of backlash by the abuser for telling other people about the abuse?
They should leave and go to a women's shelter or a men's shelter, whatever kind of shelter they need. They should, if they're afraid of backlash, get out. Go somewhere, that is either unknown to them, if you're able, or where there's protection of people you know and love and who will work on your behalf. But there's women's shelters. I was involved, and I'm very proud of this. In 1969, I was involved in establishing the first women's shelter in Illinois.
Wow, congrats.
It's important, very important. And they're all over the place. Now you can, I mean, not as many as there should be, but many women experience domestic abuse. And I was going to mention that what do you do if there's domestic abuse? Go to a women's shelter. Go somewhere. Leave. Because people like that, if you're afraid of them, who wants to live in fear? And it's terror to live that way. It's a form of terror.
Absolutely. Yeah, the second half of the topic today is survivors of abuse. So we've talked a lot about people who may be currently going through an abusive situation. But for those who have gone through abuse in their past, whether it was childhood, young adulthood, even it could have been last week or a year ago, something in the past that's no longer happening to this day, but they may still be experiencing and feeling some of the residual effects of that abuse. What would your advice be for someone who may not be in it now, but is still feeling the effects of what happened to them in the past?
They need to do some counseling, go to a support group with other people who they can share with. There are groups called Survivors of Sexual Abuse in Chicago. It's sort of like a 12-step program for survivors of sexual abuse. I'm sure they're everywhere in the country. not as much if you live in a rural area or something, but it's very prevalent.
Mm.
And,
So if somebody has experienced abuse
yeah.
before and they're watching this, can you give them, some encouragement if somebody's wondering if this is what happened to me, even as much as it sucks, this is just my life going forward, and they just accept the results of what happened to them and maybe don't even know that, there are tactics and healing out there available to them. How would you encourage somebody who's going through that?
Say that first of all, I got over terrible childhood abuse, not my parents, other people, but um, it is you can get better. You can get well. You can lead a normal life. For many people, it's poor me. I had these things. Poor me. Yada yada. Well, yeah, poor you, but you're having that poor you attitude is ruining your life currently.
Mm.
And so that's one thing. What would I say? What you do is you dig up the unpleasant event. It relives for a while, briefly, and then it goes out. It fizzles out, and then you're kind of free from it. And it's like after you get free from it, it's like watching a movie or being on a train going forward and looking back and seeing the past. Oh, it's back there. I kind of remember that. I don't feel it, but I remember it,
Mm.
and that's very freeing, and it frees up energy to live a healthy, wholesome life. And I hope that's what people do.
Yeah, absolutely. So for anybody out there, maybe this is something you keep to yourself or you've only shared it with a select few people. Just know what happened to you was not your fault, and healing is available. Whether it's great or minimal, whatever, there is healing available. There is light at the end of the tunnel. There are people dedicated to helping others, such as Ro, and other therapists that can help walk you through this process of whatever kind of abuse you may have gone through. But if you're dealing with either abuse now or the residual effects of abuse from the past, just know that there are a lot of options out there. Ro talked about women's shelters, men's shelters, even the fact that we have now that phone number, 1-800-25-ABUSE in Illinois, and then every other state has their own number. Like, the resources are available. So please, don't suffer in silence. Don't think that this is just life and that's the way it has to be. There are lots and lots of remedies out there for you to heal and not have to carry that stuff with you going forward.
Right. And also in every state, if you Google it, your state, your city, women's shelters, survivors of incest, survivors of this, it's amazing. I started doing this work, working with eating disorder patients who are bulimic or anorexic, whatever. 60% of them had abuse and trauma.
Mm,
And so I started doing work in trauma because ultimately that's where it led to unearth the thing that's like it's like a sore that never healed, and it can heal.
absolutely. That's great. Yeah, one thing I actually want to hit on, that's kind of personal, but it's a topic that needs to be talked about too, and it often isn't talked about. We always talk about sexual abuse, domestic violence, child abuse, but a very real thing out there that unfortunately not a lot of people talk about, which I'm going to talk about right now, is spiritual abuse. And what
Really?
that is, yeah, and what that is when you have a religious leader that you
Oh,
trust and they end up abusing their authority over you,
true.
whether knowingly or unknowingly. But that's a very real thing that spiritual abuse does exist, unfortunately. We'd like to think that religious leaders are the ones setting the example and the ones that we can follow. At the end of the day, everyone's human. We all have the potential for error and the potential for doing wrong. But that's a very real thing, too, spiritual abuse. You can have people in religious institutions that will abuse their authority over people, or constantly make excuses for their behavior, but then come down on everyone else for their behavior, and just abusing their authority, making you do things that you don't necessarily want to. And it's not like, oh, you have to do sexual stuff, like just like, oh, you have to come to our religious meetings, 3 to 5 times a week. And even if you don't want to, well, this is what you have to do. And so there's a
Going to hell,
plethora. Go ahead.
right? Or else you're going to go to hell.
Yeah, and that could be part of it too. But just it's a very real thing. I know people who have experienced it personally, but I just wanted to bring that up because I know oftentimes it's overlooked when, like I said, we talk about sexual abuse and child abuse and all these things. But spiritual abuse is very real. So if anyone watching has experienced that, just know that you're not alone. Just know you're not the first person it happened to, and unfortunately, you won't be the last person. But we talked about earlier that gut feeling when you kind of know something's wrong, but then you'll use your brain to make excuses for it and to justify it. Don't ignore that feeling. That feeling is there for a reason. It is there to protect you. And the same way Rose said before, if you have certain inclinations or certain doubts, ask your friends and family members, ask people that you trust, and be willing to uh, be willing to be told that what you're experiencing isn't good for you, isn't normal. Because of course, when you find out that something isn't good for you, that needs to result in action, because then you need to do something about it, or else you're willingly a participant in this abuse. So just be aware of that, because it's definitely very real. It is unfortunate, but it is definitely very real. So you mentioned earlier that abuse can lead to PTSD. So what symptoms indicate a diagnosis of PTSD and trauma?
Depression, flashbacks, inability to sleep, night terrors, nightmares, fearful of intimacy, acute depression. Some people they go into disassociation. They sort of live behind a plexiglass glass or a glass window, and the world goes on outside the glass window. And it's a way of living in your head and not being a part of life. So those are things. So the manifest ones are fear of places, fear of people, dreams, sleep, flashbacks, intrusive thoughts of, like, if you were raped, you might be walking down the street and go, "Oh my God, maybe I'm going to get raped today."
Mm,
Even though today's a fine day and nobody's out on the street.
mm,
But it's living with the fear of some trauma that has happened will be reinstituted or happen again.
wow. Yeah. Again, this is the question portion of the show. If anyone has any questions or comments about abuse or any mental health or therapy related questions, please don't be shy. Please type it in the comments. We are here to help and share our information. So I'm curious, I think I want to dig more into what a person can do when they realize that they're in an abusive situation, whether it's physical, emotional, spiritual. So if you can give anything else that maybe we haven't talked about, but ways that someone can escape an abusive situation.
Well, I think we've talked about them, but I repeat them because they're so important. Get help, get professional help, join a support group of some kind, get support. If you can, get out. If you can't, at least get support that will help you toward changing your life. There are a lot of
Mm,
places women who've been abused who get retrained for a new career, who live temporarily in a sort of a group setting. Um, don't stay with it because it'll only get worse. It will only get worse.
mm. Yeah, so I'm curious, what advice would you give someone if they have a friend or family member that they know of that without a shadow of a doubt this person is in an abusive situation, whatever that abuse may be, and the person in the situation either doesn't recognize that they're being abused or have accepted it for some reason. What can an outside person do for someone who's in the situation that either doesn't know they're being abused or have accepted it or just doesn't see any way out of it?
Right. Well, I would talk to the person privately. I might have the person talk to a counselor of some kind, or go with them to talk to a counselor of some kind, or go with them to some kind of support group to help them begin to break down denial, because denial kills. It really does. Oh, it won't happen. He won't harm me. Oh, yeah, he will. So it's if he did it once, he'll do it again.
Wow.
It's guarantee. It's just, I've never heard of anyone who stopped it,
Wow.
or at least going to jail or at least getting intensive professional help.
Wow. We do have our first question. The question says, if someone was abused as a child, are there characteristics that person would later look for in a partner related to the abuse without realizing it? Excellent question.
It's called the nuts in your head fit the holes in mine and vice versa.
Wait,
Walking
I'm
down,
sorry. Can you repeat that? What was that?
the nuts in my head fit the holes in yours and vice versa. The
Wow.
people decide the relationship the first day they meet. And the nuts in your head fit the holes in mine. And you come together in the, oops, I dropped you, in the capsule of a marriage or a relationship to try to heal each other's wounds. Um, Now, sometimes that works and sometimes it doesn't. But it's like being in a tunnel. Being in this capsule is like being in a tunnel, and instead of things just sort of flying out into space, they bounce back and reverberate for you in a relationship to attempt to make it work. If it doesn't work, don't stay. Don't
Mm,
stay. But yeah, the nuts in your head fit the holes in mine and vice versa. And
wow.
people decide the relationship unconsciously the first time they've ever met.
Wow. So if you can help me, because I don't know the exact term, but I know that there is a term out there that when a person has been abused, especially by a partner, and they've gotten used to it, I think it's like, it's not codependency, but there's a term out there that the person kind of gets used to the abuse and no longer fights it.
No, they just accept it because they're passive dependent, or maybe they're codependent, or they're afraid to be alone, or afraid to get help, afraid to have no supports around them to
Mm,
help them out. Yeah, I've seen it over and over again. It's less so these days. You only dropped you. Less so these days because of the resources available to people to help them get out of bad situation. Um, but yeah, people just become, well, whatever. But thank God for Oprah. Didn't like her in a lot of ways, but I think she did some really good things for our society in terms of opening the envelope and the door to discussing the undiscussed, previously undiscussed. Didn't happen. Never, no one talked about it, didn't happen. Well,
mm.
it happened.
Yeah. So going back to that question, because I really like it and I thought it was interesting. So they were basically saying, is there a probably an unconscious means that people end up looking for in a partner that somehow ties to their past abuse?
Absolutely. Absolutely. Some people, they unconsciously say, oh, this person could end up abusing me again. We can deal with this situation again. Or this person is the kind of person who will never abuse me. And that's a better choice to make. But the unconscious is very strong and people connect to each other by unconscious. I know 5 people who've been married who said they were going to get married the first time they met and who
Wow.
had led for 50 years, very happily, in fact. But that's by far the minority rather than the majority. So
Okay. That's great.
the unconscious is very strong in that.
Say that last part again.
The unconscious plays a very powerful role in that. If one has been abused in a childhood or whatever, and they get into a relationship and find that it's beginning to look a little iffy, get out. Your feelings will not lie to you.
Mm.
Your head will lie to you. Your feelings will not.
Yes, absolutely. Curious. So if we can talk about, because I know when it comes to abuse, there's a handful of things we go to automatically. So again, the sexual abuse, domestic violence, child abuse. Can you talk about some of the ways or situations or scenarios that are kind of uncommon but can still be considered abuse? So like I'm thinking in my head, like let's say a supervisor or manager at work that abuses their authority over you, something like that. So can you talk about some other scenarios such as that that people may not realize?
Called a power differential. Your boss, he's in a position to take away your livelihood, to get you fired, to file a false report on you, or she, it could be a she doing that also. Tends to be not as much, but it could be. And it's fear of authority, you know, fear that they're going to punish you in a way you were punished during your childhood in some ways. Better not rock the boat. Better just smile politely and let this all pass, and it'll go away. Well, it won't go away,
Yeah.
unfortunately. If
Yeah.
that's the new job.
Yeah. No, that definitely stinks when people take advantage of their authority over others. And I really, you hit on this, but I really think it's just, it's indicative of some kind of lack within that person, whether it's a lack of self-confidence, so they feel better by putting someone else down, or
They
like
also,
you said, they've
they
experienced.
also have radar. They also have radar to see who's been violated in the past. They pick them up. The nuts in my head fit the holes in yours, and vice versa. They
Wow.
can by this person will be an easy mark to abuse in one way or another.
Mm. And yeah, and then you also mentioned a great point before too that people who abuse may have been abused themselves, and they're just repeating the behavior that was done to them, whether consciously or maybe even unconsciously. They're not even aware of that. So that's interesting. I want to talk about that real quick because I didn't even think about that. We're talking mostly about the perspective of the person being abused. Let's play devil's advocate for a minute and let's talk about some of the ways that someone can recognize that they may possibly be the abuser in the scenario. Because again, we always talk about the person being abused, but sometimes people can be the abuser and not even realize that their actions are abusing someone. So, are there some things that you can mention right now that a person can take inventory of themselves and ask themselves if they're doing XYZ that may be leading to abusive behavior that they're not even aware of?
Well, yeah, they need to be told this is helpful to me, and uh, they have what's called behavior dystonic and syntonic. Dystonic is, oh, I abused someone, therefore I need to change because this is not good. Syntonic, which is someone, not bad, I think I'll try it again. And people who continually abuse have the syntonic part, which is, it's quite okay with them. And just, oh, temper, I couldn't help it. Well, you know what? Someone you hit or hurt or whatever, they can't help it either. They need to get out. But there's people who were abused and don't know. I had a kid once. He was 13 years old and he was being arrested for sexually molesting his brother.
Mm.
Well, no one him if he were being sexually abused, which he was by an uncle. And so the media was the message, so to speak. His behavior toward his brother got him in trouble, but then it unearthed the whole family dynamic of sexual abuse going on.
Wow. Yeah, that's very true. I
There's
want
a
to mention, go
Go
ahead.
ahead. No, I was going to say there's also a concept of a little known abuse called sibling abuse. The parents just sort of ignore it. Didn't really happen. It's okay. He's just little being a kid, yada yada. It's a very real phenomenon, and the
Wow.
parents are inclusive in it. Collusion means a silent agreement to hurt someone.
Wow. That's very well said. So I always want to mention in our show that anyone watching this has access to our therapist. I know Ro in particular, she is taking on new clients. So if you as our audience would like to get in contact with any of our therapists, if you feel like you may have clicked with someone on a level and you feel like, I feel like this person, I clicked with them and they'll understand my situation. Please, the purpose of this show too is to connect you with real life therapists that are in practice right now to this day. So if you can, when you get a chance, as soon as we finish the live, please click the link in my bio. The link in my bio will bring up several options. The third one down says Therapy Thursdays. When you click on that link, it will bring up an online spreadsheet with every single contact detail for all of our therapists. You'll get their names, the names of their practice, their phone numbers, email addresses, how much they charge, what types of insurance they accept. The purpose of the show is to connect you with real therapists. So please utilize that option. Please know that all these therapists want to work with you. They want to help people. But of course, you have to want the healing for yourself. As wonderful as Ro is, she is not going to hunt you down and force therapy upon you. So she is more than willing. I know she has an open door policy. She's more than willing to meet with you guys, any other of our guests as well. But please utilize the link in my bio, click Therapy Thursdays. It'll bring up a spreadsheet with all the contact information for that. We are slowly winding down. We have a few minutes left. I want to ask you, Ro, a final question. Are there any books that you recommend for those who are currently being abused, as well as those who have survived abuse?
Yes. However, since I had the technical problem that I was going to go look up the books, I didn't get a chance to do it. So I will send it to you to pass on to others, and it can be in your website page. Okay?
Okay, great. Do you have any that come to mind right now?
I do, actually. One is a book that I read many years ago, and it changed my life. It's only 90 pages, and it's called The Drama of the Gifted Child.
I heard about that.
It's a great book, changed my life. I recommend it to anyone. It's 90 pages. It was translated from German to English, so the English is not a little formal, but basically it says, after I read it, I felt like I'd been hugged for 2 hours because I didn't know that the kind of emotional abuse I was experiencing as a child was being written about as, because if people aren't empathic to you, they're just giving you information, and information is persecutory. Do this, do that. Well, that doesn't help. Let me help you do this. Let's see if we can both do together this. If you grew up in a home that was very critical, unempathic, cold, read that book. It'll change your life. It really has. I had a 17-year-old patient once who read it and really got it. So it's for all people. Another book I mentioned is Trauma and Recovery by Judith Herman. The other book, Drama of the Gifted Child, is by Alice Miller. The one I just mentioned was Trauma and Recovery by Judith Herman. Like I said, don't read the first 150 pages, but read all the parts about the trauma. There's some more recent books, and I don't have them available right at the moment to give to you, but I will send them to you to pass on to other people.
That's great. Thank you so much for that. We have a little less than 2 minutes left, but again, we talked about a lot of different types of abuse today. Abuse is a very, very general topic. It is a big umbrella term where lots of different situations and scenarios fall underneath that. But if anyone watching this, whether live or later on when I upload this later, if you feel that you have either learned something from this episode or maybe have realized that you are in an abusive situation or a friend or a family member are in an abusive situation, just know that there are tons and tons of resources available to you. It may be uncomfortable. It will require you to have some courage and fight some fear of staying in the same scenario. If you have fear of backlash from the abuser, just know that those are okay feelings, but just know that there are people like Ro and other services that are more than willing to help. And if it's abuse from the past and you may have residual effects of it, just know something like formal therapy is an amazing tool and can definitely help you grow from that and be able to let go of a lot of the pain and trauma and anxiety that this situation that wasn't your fault may still be following you to this day. So you are not alone, and there are many options available to you, and please, please, please take advantage of those options. We're going to wrap it up. Ro, do you have any final words for our audience?
Reach out for help. It's not your fault. You didn't cause it, you can't cure it, and you can't control it. But you can take care of your own self and get help for whomever or whatever you need. Don't live with abuse. It's a disgusting, horrible thing. I hope good things for you all and for your friends. Sending you good wishes.
Awesome. Thank you, Ro, so much. You're always a pleasure to have on as our guest. We're going to wrap this up. I'm going to finish with our disclaimer. As always, our disclaimer is that this show is for informational purposes only. You are completely responsible for what you do with the information presented, and myself and all of our guests cannot be held liable for any misuse or misunderstanding of the information presented. Please always consult a trained mental health professional before making any decisions regarding treatment of yourself and others. So everyone who joined tonight, thank you for joining in. We appreciate you. We'll be back next week, next Thursday at 7 p.m. Central Standard Time with another wonderful guest therapist talking about another wonderful mental health topic. But thank you for joining us. Ro, thank you again for being our guest. And everyone have a good night, and we'll see you next week.
Work, work, work. Watch you do my